Good morning all. The topic of my presentation is post-endodontic restorations, which will be taken in part 1 and part 2. Coming to this, first we see why we have to make a post-endo restoration. For endodontically treated teeth, we have to assess the following criteria. First, it's root filling material, active inflammation, pressure sensitivity, exudate or fistula, periodontal disease, severe damage. If yes or any, we have to go for re-RCT or monitor or extract the tooth. If not at all, we have to continue. For anterior teeth, we have separate post-endodontic restoration. For posterior teeth, we have separate endodontic restorations. For anterior teeth, if marginal coronal damage is there, intact marginal ridge, intact cingulum, intact incisal ridges, and intact other features. Significant coronal damage is there, that means undetermined marginal ridges, loss of the incisal ridges, coronal and the fracture or aesthetically unacceptable. We have to go for post-endo restoration. Moderate coronal damage, one or the two large prominent lesions or average tooth structure is present, we have to go for post-endo restorations. For posterior teeth, cuspal coverage, minimal coronal, minimal damage, moderate damage, significant damage. Minimum damage we includes low risk of fracture, minimal occlusal forces, intact buccal and buccal and lingual cusp. Moderate coronal damage which includes minimum one sound cusp or alternate extreme the root resorption cases. Minimal coronal damage and anterior tooth which includes minimal coronal damage which includes complete the coverage or not required. Anterior tooth which requires moderate coronal damage, one or two large posterior incisors, average tooth size, we have to determine the average tooth size followed by means of full coverage code is required or not, we have to decide. For posterior tooth, it is minimal coronal damage which includes low risk of fracture, minimal occlusal forces, intact buccal and lingual cusp. For moderate coronal damage, we include moderate the cuspal damage followed by means of, and we have to determine the curvature of the root. Then there is a significant coronal damage, we have to go for the little or no remaining coronal tooth structures, IPD or the RPD substructures of the regions. Then followed by means of some impact the tooth regions or small circle or extremely this region. Coming to structural and functional challenges of endodontically treated tooth, the role of moisture loss and nature of dentin we have to determine, followed by alteration in the strength caused by the architectural changes in morphology of the teeth, concepts of biomechanical behavior of tooth structure under the stress, biological width, protecting the remaining coronal tooth tissue, creating the ferrule. What is biological width? The biological width, which is usually 2.5 millimeter, which is nothing but a combination of both pre-cervical gingival, that is 1.7 mm, followed by means of 2.4 mm, coming to the core of crest of the bone. What is ferrule effect? This ferrule effect in molars and ferrule effect in the incisors. This ferrule effect is nothing but a small incisal, the small covering which is placed over the cingulum region or over the over the crown structure, which is known as the ferrule effect, which helps to prevent the tipping action of the forces which is given on the cervical area of the tooth, such that the tooth won't step and hence prove and hence it has good post-endodontic restoration stabilities. Kogan classification: teeth with minimal tooth loss, coronal restoration; teeth more than 50% remaining coronal structure restored with the crowns; teeth with 25 to 50% of remaining tooth structure restored with a non-rigid post; teeth with less than 25% of remaining tooth structure to be restored with rigid post. Choice of post-endodontic restorations: direct restoration, composite, amalgam, GIC. These are direct restoration where there is adequate tooth structure is there and four-wall defect is not seen, where we have to give this direct the restorations. Indirect restoration, which includes inlays, onlays, full crowns, endo crowns, post and core with the crowns. Coming to inlay, onlay and crown. What is the difference between the inlay, onlay and the crown? Inlay which is usually given, inlay and onlay which is usually given on occlusal defects followed by means of class 2 and the involvement of severe class 2 cases. Whereas full coverage crown, where there is a 3-wall or 4-wall defect, we will consider as a full coverage core restoration. Now the specialization which involves the endo crown, which is usually given for short vertical root height, short clinical crown height, followed by means of aesthetically compromised teeth. Foundation restoration post provides retention for the core, must be designed to minimize the potential for root fracture from the functional forces. Core, it replaces the lost coronal tooth structures and it provides retention for the crown. Coronal restoration, crown restores function and aesthetics and protects root and crown from the fractures. Core, resin based composite, silver amalgam, cast gold, glass ionomer restorations. Nowadays this amalgam restoration is not followed anywhere. Post, it is classified into parallel, tapered combination, active and passive, prefabricated or custom made, metallic or non-metallic, threaded, serrated and smooth. These are the classification of the post which are going to see. First, tapered and parallel post. What is the tapered post and what is the parallel post? Tapered post is nothing but a 6-degree post which is usually inserted on this. Parallel is uniform parallelity will be seen from tip to the end. Under that is different types of post, which is serrated, threaded, smooth post. This threaded and serrated post is nothing but a cross post restoration which we have followed in older days, and then thread mat system what you study in your second year. Coming to prefabricated post, how this prefabricated post is made, which is usually made by taking impression of intracoronal restorations by using putty or any other material. Then it is fabricated in the lab and it is inserted into the tooth part. This prefabricated post is of two types, passive post and active post. This passive post is tapered post which has minimal natural canal shape, less amount of retention is there in case of passive post. Whereas active, it is usually indicated in case of short canal space and it provides rigid structure and it helps in maintaining the tooth textures. Retention, parallel post is compared to give more retention when compared to that of tapered post. Loss of tooth structures more with parallel compared to tapered. Wedging forces more with tapered than parallel, hence combination is preferred. It's active post, it's more retention with threads but more of wedging forces which leads to breakage of the tooth than passive serrated or smooth surface post, hence parallel smooth serrated or vented post given less amount of forces. These are the difference between the post which is threaded post and this is a smooth post, this is parallel post and this is a 0-degree post. This 0-degree post is nothing but is minimal coronal restoration and it is a newly discovered post. These are the different types of poster. First thing is a normal fiber post. Second one is carbon fibrated post. This third one is glass ceramic fibrated post. These are the various thread made systems. Coming to crowns, we see about the metal crowns, all ceramic dental crowns, all resin crowns, porcelain fused to metal crowns. Metal crowns are usually indicated in case of child restorations or SS, that is stainless steel crowns. All ceramic or dental crowns is depends upon the anterior aesthetic rehabilitation of the crown. All resin crowns is indicated in case of orthodontic brackets patients. Porcelain fused metal crown is indicated in posterior restorations. These are the difference between the cast post restoration and difference between the fiber post restoration. In cast post restoration, we will give the ferrule effect. There will be more withstanding forces in the crown part than the wedging forces will be equally distributed laterally, such that there will be no catastrophic effect which will be seen on the tooth. Whereas in case of fiber post, the wedging effect will be accumulated towards the central part of the post, which leads to the cracked tooth syndrome or vertical root fracture of the tooth. Chipped or discolored tooth is prepared, crown is placed, final result. These are the clinical examination.